So our agenda, I'm going to explain a little bit about clinical hypnotherapy. We're going to talk about what it is, really briefly, how it works. I am by no means an expert. This is something that's actually fairly new to me. I took a couple of trainings on it this past spring and summer. So I've been doing it short of a year now. And I found that it can greatly improve the quality of life for a lot of the people that I've been working with. And I've also used it on myself. But with chronic illness and chronic pain, that's really difficult to treat. I found it particularly helpful as kind of a complementary therapy. And so that's what I'm hoping we can talk about tonight. And I'm hoping that we can approach this as kind of an experiment, because I know this is a little, woo-woo for a lot of people. A lot of people are very, they don't know what to make of practices like this. So I'm just inviting you to be experimental and very open-minded, and to kind of feel this out a little bit with me tonight. So you all know a little bit about me. They did a bit of an introduction. These are my two favorite dogs, Gordon and Ruby. I'm also an animal lover in addition to all of the work stuff that I'm doing. But yeah, I'm working on my dissertation right now that talks about women's experiences with migraine care. I'm also a migraine patient myself. I've had chronic vestibular migraine for a long time now, close to 20 years. And so I myself have been a patient in various settings and have had to try a lot of different treatments and strategies to learn how to manage my symptoms over the years. So I'm not just speaking to you as someone who's studying this or looking at it from the outside, but I'm also talking to you as someone who's been there themselves. So what is clinical hypnotherapy? People certainly have images and thoughts that come up for them when they hear the word hypnotherapy, right? So some people start to worry about it. Is this something that requires someone to have control over my mind? Am I handing over control over my mind when I'm doing hypnotherapy with someone? And some people automatically think about stage hypnosis. Some of you maybe have been to a stage show before where they've done hypnosis, and you might wonder if the person hypnotizing you is going to ask you to do something silly like cluck like a chicken. So these are some of the stereotypical thoughts and images we have come up for us when we're thinking about what is hypnotherapy. But clinical hypnosis is nothing like that. So I have here a couple of definitions. These are just basic definitions that describe what we're talking about today as we talk about hypnosis. And very simply, it's really a technique used to help us enter a state of trance where we can tap into our subconscious mind. And we do that for various reasons. So considering a lot of our behavior and habits are rooted in our subconscious mind, or at least that's how hypnotherapy, that's kind of the foundation that they build hypnotherapy on. This technique is really valuable. A few years ago, I did a talk for Migraine Canada and also a public talk in Hamilton about migraine and mental health. And I discussed classical conditioning and how traumatic experiences, like having repeated migraine attacks in public spaces, for example, might cause someone to develop a traumatic response, right? They might have agoraphobia afterwards, or they might develop OCD type behaviors in response to that trauma. And over time, these behaviors and thoughts and how we see ourselves in our own story, so to speak, become more ingrained and habitual. So hypnotherapy might be a way to shift our perspective a bit so that we can alter those states of being. And it can also impact how we think about and perceive pain or other disabling symptoms that are part of the migraine attack for many people. Because pain really does start in the brain. and our perception of events and things that are happening to us can amplify our sensations or can calm them down. So we use a lot of, or we use hypnotic techniques to interrupt patterns of behavior that we believe that clients have all the resources and the answers that they need inside of them to figure their way through a problem, right? So hypnosis just unlocks the door to those answers and resources. That's all it does. And at the end of the day, we're talking about hypnosis. I'm going to use this word placebo because this is a type of placebo medicine. And I don't use that word in a negative way. I'm actually using it in a really positive way. I think placebo is some of the best medicine we have. We're really tapping into this idea that we can harness the power of the mind to manage something that's happening within inside us. That's really what it's about. And that can be a really powerful thing. So our mind can really be split into two categories, right? So we have this thinking mind, which is our critical consciousness, and then we have the subconscious part of our mind, right? And the thinking mind is really focused. We use it for all kinds of things like analysis or decision making and new learning, working through memories that are brought to the surface or short-term memory. And for those of us who tend to be anxious, this is the part of the brain that doesn't like to turn off. This is the part of the brain that keeps you up until 3 a.m., Googling random things on your phone. Yeah, so that is the critical consciousness, but the subconscious mind is responsible for a lot of things that we might not be aware of, right? So often when I'm working with clients, I like to ask them about and explore things like core beliefs and values, which is really the framework that lays the foundation for many of our behaviors and thoughts. So we really take that framework for granted. I also do a lot of psychodynamic work, which is a fancy way of saying I work with clients around trying to figure out how a problem started in the first place, because usually issues like anxiety or depression or relationship challenges are rooted in very early experiences that we kind of suppress. We don't really think about them consciously. But those experiences are stored in our mind and our body, and they influence many aspects of our life, right? That's just a part of the process. So when we use hypnosis to tap into that space, we can work to shift some of those core beliefs and feelings in ways that are motivating or that might support other change processes that we're engaging in consciously. So hypnotherapy might be really good when paired with things like cognitive behavioral therapy or exposure therapy when you're trying to work through particular issues. So I put this in here because I think it's really important to reflect on before we're going into hypnotherapy. Because the main takeaway that I want you to have tonight is thoughts don't need to control your life. And I know that's really difficult sometimes for us to wrap our minds around. And I think, the next webinar where Kelly's talking about brain retraining, I think that's something she's going to talk about quite a bit as well. Because we develop a lot of thoughts around our pain or concerning our pain and our illness over the years. And I think the more chronic or intrusive symptoms are, the more intrusive and debilitating your thoughts or perceptions of what you're going through can be. And by all means, I don't want to diminish anyone's lived experience or perception of disability, because obviously that's very real. But I do want you to reflect on where and when your disability is truly disabling, and when and where could your perception be adding to that disability, because I think those are very different things. Okay? And I know from my own experience, just in my own life, but also working with people in a helping capacity for the past 20 years, thoughts can keep us really stuck. And perceptions of what is happening with us can keep us really, really stuck. And it can limit us. It can limit what we do and the actions that we take. And there are many factors that affect our ability to be resilient and function or not function. But sometimes we end up doing that to ourselves by limiting ourselves with our own beliefs or thoughts about our own story. So I want you thinking about that. And again, I know that can be really difficult because there is a balance, right? If you're really dizzy and have vertigo and really intense pain, I mean, that's going to take you out at times. But I'm talking about situations where I know for myself, I have come up with these narratives that if I do certain activities, I'm going to trigger my migraine, and it's held me back. And the reality is, when I've pushed myself to do those things and move past the fear, I don't always trigger a migraine attack. So I had to really think about, am I holding myself back because I'm protecting myself? Or maybe am I holding myself back from certain things unnecessarily? That gives you maybe a bit of an example of what I'm talking about. So as we're moving into the process of hypnotherapy, all of my work with clients is collaborative no matter what, but hypnosis should be collaborative. So if you're doing hypnosis with someone, if this is something that you decide to explore, maybe you've been to a practitioner before, you should be doing this work with someone collaboratively. They should be asking you about input. What is it that you actually want to work on? They should be coming up with a plan of action with you. And if they're not wanting to do that, that would be a red flag for me. I tend to use scripts for hypnosis that are tried and true scripts. And that's because I'm new to this practice. Practitioners that are further along, they will often write their own scripts based on what the client is wanting to work on. That's part of the technique that people learn over times. And there's different components to the actual hypnosis process, right? So interventions can vary. Tonight, we're going to do a very simple one. That's geared towards managing the symptom of headache. But for some people, that might be a way in. For other people, other interventions might be more appropriate. Maybe they want to focus on relaxation or relieving tension. Maybe they want to focus on relieving other symptoms of migraine, such as nausea or vertigo. So this can be a very individualized process. Hypnosis shouldn't be done in certain circumstances. I just wanted to throw this in. Hopefully no one is going through any of these things tonight. I would hope not, but if you are, please seek out support. But I would never do hypnosis with someone who is acutely suicidal or who's under the influence of drugs or alcohol or who is experiencing psychosis. Some things to keep in mind as we're going through this, as we're winding up through a demonstration. So the first thing is, hypnosis is this very natural state. And I learned this past year that it's actually something our brain does every 90 minutes or so. It's very, very natural. So you can think about experiences where maybe you've been driving quite a while in the car and you go into highway hypnosis. That's because that's a natural part of our brain cycling. You know, there are times when you might experience a moment of disassociation. Maybe you're concentrating on something really hard and all of a sudden you kind of have a blip and you tune out for a minute. That again would be a natural rhythm that your brain is in, where every 90 minutes you do go into a hypnotic state. Okay. I also want you to keep in mind as we're going through this that if we go through the demonstration tonight and you're restless and you're really struggling with it, I just want you to know it takes time to get good at something like this. So if you were to start practicing meditation or hypnotherapy with someone, you would practice it on a regular basis. You would work towards strengthening your brain's ability to do this type of work. It's like working a muscle out at a gym. It's something that takes time. So when I'm working with a client, for example, and we talk about doing this to address a particular issue, I might start with suggesting, hey, um, for the next couple of weeks, I'm going to record or send you a meditation. And I want you to do this short 5-minute meditation once a day and just see how that goes for you. And then we'll review that and see where they're at. And if they're mastering that ability to do that meditation, then we would move on from there. So now that you have a good idea of what hypnosis does emotionally, potentially, and cognitively, let's talk about the body for a minute. So we're mindfully activating your parasympathetic nervous system. And so this is the part of the nervous system that relaxes us, right? Call it rest and digest part of the nervous system. And through hypnosis, what we're really doing is we're tapping into different brainwave states. So the first brainwave state, beta, is what you're probably all in right now. It's the alert thinking part of the brain. You're concentrating on something. But as we move into the alpha brainwaves, those are the brainwaves that are more associated with things like relaxation and even light hypnosis. So the type of light hypnosis that might come up for people when they're doing a meditation. And it's possible, arguably, that anyone can achieve this state, right? We all go into this state. But our goal for hypnosis is to try to move into what is called the theta brainwave state. And this is where deep hypnosis can take place. So I explain to my clients to think about that comfy place between being awake and being asleep. And for me, what comes up is when I'm lying in bed at night and I often fall asleep with the TV on, and I can get to this place where I can still hear the TV, but it sounds like it's way off in the distance and I don't really know what they're saying anymore on the TV. I'm aware that it's there, but I'm a bit disassociated. So that is the place that we really want you to try to get to when we're doing hypnotic work. Hypnosis also activates our brain's limbic system. That becomes more active and it's responsible for emotion and memory, motivation and behavior. And in the prefrontal cortex, when the system is activated during hypnosis, you might be able to learn how to change automatic responses to situations, right? Because that's what we're trying to get to, your habitual automatic reactions to things. So if you're thinking about what is the process and what are we actually going to do tonight, this is basically what we're going to go through. We're going to move through a hypnosis process. I'm going to do a bit of a demonstration. Hopefully all of you are somewhere comfortable and quiet, maybe at home, maybe sitting in a comfy chair or in bed. And we're going to move through this process. Normally, I would build rapport with the person that I'm doing the hypnosis with. Obviously, in this situation, it's a little bit different, and I can't really do that. But hopefully, you've gotten to know me a little bit. Maybe some of you have heard me speak or know me, from the research or other things that I've done. So hopefully, you feel comfortable doing this with me tonight. But the first thing we're going to do is we're going to go into something called an induction. And so the induction is what we do to start to slow down those brainwave states that I just talked about. It's a technique. There's a lot of different ways of doing inductions. I'm going to do a lengthier induction tonight. The whole thing is going to last about 20 minutes, the whole hypnosis session. And the induction technique that I'm going to use is going to have you count down in an elevator. I just like to tell people that ahead of time in case people have some phobias or fears around elevators. But I really like this one because it's slow and it can really help you get into that more relaxed state. And then we do something called a deepening technique, which continues to build on that, right? So we're working towards relaxing you as much as we possibly can and getting you into that place where, again, you're not asleep, but you're not quite awake. You're disassociating. You're in a really relaxed, mellow, Zen state. And then we get to something called suggestion ego strengthening. Tonight, what I'm going to be using is, again, a tried and true script specifically for headache. And we're going to see how that goes over. And again, for some of you, this is going to work really well. Some of you might have a headache right now or a migraine based on the crazy weather that we've been having, although it is a beautiful day where we are in Ontario. But for some of you, this might not really be what you need tonight. And again, that's okay. This is just about demonstrating what could be. And I think what anyone can take away from this demonstration tonight is to feel relaxed, to feel less tension. And it's too bad we couldn't have more of a debrief because I'm really interested to know what some of your thoughts are and what comes up for some of you as we're moving through this demonstration. And then we're going to conclude. I'm gonna count you out, and then hopefully you come to feeling refreshed and awakened afterwards. And we can go into some questions and maybe a little debrief. We'll see how that goes. So I think we'll move into the demonstration. Like I said, hopefully you all have a comfortable place that you can be right now. You can keep your eyes open or closed. It's up to you. But treat this like you would treat a really deep guided meditation, because essentially that's what we're doing. I like to start off by asking people to set an intention. So if you can do that right now, think about, what do you want to get out of this practice? Think about what it is you came looking for tonight. And it could be something as simple as, I just want to be open to something new. I'm open to experimenting with something new tonight. And I just want to see what happens because I'm really curious right now. So maybe that's your intention. And take a moment just to think about that. And hopefully now that you have that intention, I want you to settle into your space and allow yourself to move naturally into a more relaxed state of being. We're going to move into it now. Take your time to commit to move to a slower pace. And as you do that, settling into a slower pace, a more relaxed space, in whatever way you choose to do that, you can close your eyes and mentally relax the muscles around the eyes and in the jaw, the neck, and all the muscles around your head and forehead and the eyebrows. It's really just a process of softening the face, almost as though you were smiling gently inward. And let your shoulders drop and let go of a little more tension around the shoulders and the neck and the head and the face. And take a nice breath in and breathe out. And on the next breath in, count mentally for an inhale of 4. 1, 2, 3, 4. And do that again and see if you can exhale to a count of 4. So the inhale is a slow, deliberate count of 4, and the exhale is a slow, deliberate count of 4. Just practice that for a couple of times. And as you do that, you might begin to become more and more focused on and aware of your internal experience. And of course, you are also aware of the external sounds and distractions, but they don't have to be distractions. They can simply be the sounds of the heartbeat of life that continues on around you and brings you comfort and safety, anchoring you more and more, deeper and deeper into an external experience that's your very own. Just by breathing in and out. And in your mind's eye now, create an image of an elevator. You may visually enter the elevator, or you might imagine that you see an elevator. It's fine either way. But if you do it, imagine the elevator doors opening up and you move into your elevator and you become aware of how this is indeed your elevator. Almost like your own little elevator room just for you. It's a perfect place of relaxation and comfort. And as you decorate the elevator walls in your mind, the elevator walls further insulate you in your own internal reality, deepening your experience of going inward. Your custom design elevator space is so comforting to you. There may even be a place to sit or meditate or lie in the special, cozy, one-of-a-kind elevator just for you. Breathing in and breathing out, something about that simplicity can feel simply peaceful. And you can also become aware of perhaps buttons on the elevator wall by the doors, or maybe some sort of panel or system that indicates what floors you will be visiting as the elevator moves downward. And even though it is not moving yet, you become aware, or imagine you are aware of what the panel looks like, how you will know that you are on each floor. Will it be buttons that light up? What colors? Will it be voice command that indicates each floor? Whatever system it is, design it now in your mind's eye. Really take a few moments to carefully craft and create this wonderful internal experience of your custom-made elevator, your haven, your signal to your unconscious mind that all is well, and it is time to proceed on a journey that has already begun. Take your time. And so imagine now that you are on the 20th floor. And I will count down, and on each count, you will imagine stopping at each floor, but the doors will not open. You will simply notice a gentle stopping, a deep pause, and moving down again gently at a perfect pace for you. So you move down from the 20th floor very naturally, very gradually to the floor 19. And as you do that, because you stop briefly at 19, you feel calmer. You move to 18 and it's calmer yet. And 17, even more relaxed. And 16, noticing you notice as you notice less and less, and moving down even further into relaxation and a peaceful sense of letting go to 15. And noticing and maybe even relishing this deep level of relaxation and moving even further down to 14 and 13, more and more very deeply relaxed. You might even be surprised by how relaxed you are at 12, and perhaps how more and more deeply aware, insightful as you go down, moving from 11 to 10, deeply down now from 10 to 9, becoming less and less concerned with external realities. You can remember to forget or even forget to remember, because it doesn't even matter. The main thing is the peace that embraces like a warm blanket that wraps itself to a level of your perfect comfort as you peacefully, pleasantly drift down to 8, peacefully, deeply, at your own pace, enjoying freeing that sense of 7, in your own way for a change, 6, 5. So natural it is now to let go and to give yourself permission. And I wonder if you can go just a little bit deeper for 4 and 3, very deeply now to a beautiful sense of stillness and wonder to level 2, because you can look forward to letting go all the way down to level 1. And at 1, the doors open. And you're aware now that you are in a building feeling very peaceful. In this peaceful, beautiful building, perhaps there are windows. You even notice sounds, or if you hear any sound, as you move across the floor away from the elevator now, moving towards doors that lead outside. And you put your hand on the door which leads you outside to a wide open fresh air. You find yourself on the sidewalk, and wherever you are in your mind is perfect for you. And so you continue walking along the sidewalk, noticing what you notice. Peaceful walk, and gradually the sidewalk becomes grassy. And you're aware that you're moving into a more natural setting, less concrete, more grass, more field. You move more and more into the field, and you gradually become aware that in this field, this expanse, there's a pathway. And so now you're walking that pathway. Notice how pleasant this is, how you feel now, and what the pleasant pathway looks like. Perhaps you have a sense of how you're dressed and maybe what's on your feet. So you walk along the pathway, and you're aware that this pathway is leading somewhere. And even though you don't know exactly where, there's a sense of looking forward to following along, looking forward to walk your path. You have a vague sense of the commitment it takes to walk your path. And for a moment, you might hesitate about that. After all you came from, you can always turn back. But you make a decision now on how to proceed, to continue walking your path, and you do so. And notice how nice it feels to move forward along the path. Eventually, wherever that path is straight or narrow, or wide or windy, or hilly or rocky, however that path looks, whatever shape it takes, you follow it, and you follow it, and you follow it. And eventually it leads to a fork in the road, a branching off into 2 directions. So you stop here and pause for a moment, not sure in which direction to proceed, right or left, this way or that. And you're also aware that somewhere ahead on the path is a very beautiful beach. And you very much want to get to the beach. And it dawns on you that if you take one branch from the path, it will lead directly and quickly to the beach. And you are aware that the other branch is another path that also leads to the beach, where the sand is soft, where the water is clear, and the sun brightens the sky so clearly. You decide right then and there which path you will take. You really are committed to walking this path. And so you proceed one foot in front of the other. You proceed because it feels good to move forward. And you proceed even though at one point there is some hilly terrain. And it gets tiring climbing up that hill and negotiating the terrain. And even though you may be aware that it might be easier to turn around, you've made a commitment with focus, with intention. And so you simply anchor in this commitment as you climb to the top of the hill. There's a large bird flying overhead, and you can hear its calls and sense its majesty with all of nature beckoning you, encouraging you to continue until you are all the way on top of the hill. And from the top of the hill, you have a bird's eye spectacular view of the beach. And you're so close now, so close you can almost taste the smell of the beach in the air, and feeling so much more confident now that you've made it this far. And so the only choice is to keep going. And the sun seems to shine brighter as you celebrate that choice, that success. Knowing the success of reaching the top of the hill was born out of a long journey and a difficult climb upward. But all that is behind you now as it fades completely from your mind, fades completely out of your visual screen. It doesn't even matter. It's as though it didn't even exist. All that matters is where you're going, and you're picking up your pace now and feeling so much more confident, so much more liberated, so free to almost run now towards the beach, feeling your feet on the sand as you make contact with your destination. Enjoying that, you may even hear the waves gently and beautifully lapping on the shore. And the reward of liberation proceeding with confidence. And so really, really feel and see yourself now on that gorgeous, beautiful expanse of beach and sun. And the rays of sun warming your skin, your face, even your hair and your hands. And the perfect temperature of the water and the perfect sounds and smells around you. And breathe in all this beauty. And here you become aware that this is a very special place and time for you, meant just for you. Now I want you to picture yourself swimming in the water, away from the shore. I want you to picture yourself now as a dolphin, swimming lazily along just below the surface of the sea. Feel the water above you gently warming your back, and feel the cool water beneath you as you swim lazily along. Just let yourself continue to swim slowly along, concentrating on the images and the sensations which you feel as you continue to listen to my voice. And soon you will be able to experience everything I described to you just as if it were actually happening. You think how refreshing it would be to dive down all the way to the bottom. Let yourself begin to dive now, diving easily and gently all the way down to the bottom. Feel the cooler currents against your face as you angle your body towards the bottom, and feel yourself beginning to adjust to the increasing depth and pressure of the water around you as you continue to descend. Any previous discomfort you may have felt is fading away now as you feel the cool, soothing currents rushing by as you sink deeper and deeper, and your system continues to slow down in response to the increasing pressure and cold. The water continues to grow even colder now as you continue to sink, but your body adapts to it easily and comfortably. You continue to drift down and down, sinking past seaweed forests and deep coral canyons, sinking all the way down to the bottom. Almost there. Now you find yourself drifting slowly along, exploring the bottom of the sea. Just savor the experience for a few moments and enjoy the cool freshness as you swim along. In just a short while, I'm going to return you to your normal sense of time and place. But after you return, this feeling of peace and well-being will remain with you, and all traces of your previous headache will have vanished. Even after you return to your normal sense of time and place, you will continue to feel just as good as you do right now. So just continue to let yourself explore this undersea world for a moment or two, experiencing all the enjoyment and pleasure that goes with it. And soon it will be time to return you to the environment from which you left. I'm now going to count you up from 1 to 10, but know that you can always very quickly, easily, and effortlessly return to the core of yourself. to your infinite wisdom that is beyond all thought, beyond all emotion, beyond all external circumstance. You can return easily and effortlessly at any time to your core truth. 10, taking your time to gradually integrate all of the new learning. 9, gradually reorienting yourself to the present moment. 8, bringing your mind back into your body. 7, a nice healing and refreshing breath in. 6, moving into regular consciousness now with a gratitude and a new sense of renewed to your path. 5, feeling your body here now, feeling your arms and legs. 4, coming more and more back with your mind fully in your body now, feeling refreshed and alert. Take another refreshing breath in. 3, feeling your fingers and your toes, giving them a wiggle, feeling so happy for the journey that you're on, feeling grateful and recharged. 2, fully aware, revitalized, refocused, excellent, feeling wonderful in every way. 1, all the way back now, a big stretch all the way back in. Open your eyes and come all the way back. Okay. So that was the demonstration. I'm going to give you a moment to hopefully stretch and re-alert yourself. I'm hoping that that was refreshing for everyone. I'm curious about how people feel after doing that exercise, what stood out to them, what maybe came up for them during the hypnosis. I don't know, I was going through that and I was feeling like this is a really powerful process. I've done this one-on-one with people. I've never done this as a large group. And there's quite a few people tuning in tonight. So I feel like there's this like really powerful thing that we just did where we were all in the comfort of maybe our own homes, but tapping into this moment of relaxation and calm.